Hello everybody, how y'all doing? I'm going to try and do this video best I can, but I really wanted to record this. So, in case I need to, I can show the doctor, the pulmonologist, when I go back to see him at the end of August. So, one of the issues that I've been having, yes, chest congestion, and I know it has been a problem, and I know it's been due to allergies. But right now, sorry, there's no mucus. Everything is clear. I have been taking allergy medicine, both the internal 24-hour stuff, basically a purple box, generic brand. I've been taking that the last several days, especially with all these storms that we've been having. And also doing the nasal spray that was prescribed. Basically, for those of you who don't know, it's basically a form of Flonase, only it's prescription. I don't know if it's the same chemical composition or not. I haven't looked at it. Doesn't matter. But basically, right now we have some storms going through. It hasn't rained exactly where I'm at, but with looking at the radar, they are around, and I could definitely tell that they were in the area because I could feel the muscles flaring up. And what winds up happening is that the muscles will flare up, and they it's like pressure pushing right down, right here, right on my sternum. And what happens is it also causes my airways to constrict. And it of course makes it difficult to breathe. And of course it increases the anxieties, blah blah blah. So I had to stop. And I just stop. There's a breathing technique that I learned from this one yoga book that I had read about. Where basically you kind of regulate your breathing, doing the same amount of time that you're breathing in, same amount of time with the pause, same amount of time with the exhale, and the same amount of time with the pause, and then all over again. You're not holding your breath or anything. It's just a consistent cycle through, consistent with each of the phases through that one cycle. That's what I'm trying to say. So I wanted to make sure I do this video just in case. Because I know that we're just starting with monsoon season. And things will really be going into full gear next month. So, and it's also for people in my life who may not understand. It's basically kind of like dealing with arthritis. When you have those weakened joints, you get a storm through, and it's, like in your elbow or your knee or your shoulder or something like that. Kind of like the same thing. And sometimes I even wind up with sharp piercing pains. Not like, I know, because grab the chest, just like with, somebody who's having a heart attack would do. But I know I don't have any of those issues between the stress test and, of course, the CT here recently. The CT came back with everything being fine as far as my, uh, as far as that is concerned. But it's like sometimes if whether I'm dealing with the pressure in my chest or not, sometimes even after going through these episodes, when the muscles are, I don't know what they're doing in there, but it'll feel like I have like a little troll or a little gremlin or something living inside my chest. And they're sitting there with an ice pick and just stabbing, not stabbing this way, but more this way from the side. I mean, some of the worst stabbing pains you'd ever want to feel inside your chest. Some of it is muscle contractions and then releasing. I know it's kind of hard for me to think right now, but I wanted to record this video. So it isn't just the allergies. It isn't just mucus, even though when this is happening, it does cause mucus. That's the thing that I can't seem to get doctors to understand. It isn't just the allergies. Yes, sometimes it can cause it, but then there are times like this when I am completely clear, and then all of a sudden we get these storms in, and then bam, it's I'm not having any flare-ups. It's the pressure, it's the pains, it's the constriction, or the stabbing pains from the side that will cause mucus to flare up. So I wanted to, like, I know I keep repeating this over and over, but I'm trying to help the medical professionals to see what I'm seeing. I realize I don't have a medical degree, but I have lived either with myself or with other people, primarily my mother, with medical conditions. There is a little bit that came up. My entire life. So, and I have, with myself, as far as a medical condition is concerned, I was born a hypoglycemic. So I am in tune with my body. I have had to be in tune with my body my entire life. So yes, I understand I am not a medical professional. I do not hold a medical degree, but there's a lot that I do understand about the human body. And so I'm not like your normal patient who's just all, oh, I don't understand what's going on. I do understand. I know how I understand, I can differentiate between different things. I know the difference between different things. And the reason why is because I've had to learn these things throughout my entire life. Like I said, either with myself or with other people in my life. So I just wanted to make this video to help with the clarification on things. I do have a brain in my head. In other words, it's a difficult time. So yeah, and in case anybody's wondering with this video, with this timestamp, it's July what is it, 17th, just after 7 p.m. So you can go back and even look at the weather reports. Look at barometric pressure, things like that. So I know that barometric pressure, with things that I've dealt with in the past, with headaches, storm headaches, things like that. Basically like that. Okay? So you can look at things like that. I just want to document this so we can see the patterns, okay, and how we can possibly overcome it. Because the only thing that I've been able to figure out to do so far that works is just to chill. Stop whatever it is I'm doing, lay down, and just meditate and focus on my breathing. I have tried doing my own physical therapy, chest exercise, try and help with rebuilding the airways and the chest muscles. But I feel like, and I still feel like that is going to be the biggest thing that's going to help. But I don't know what to do. And unfortunately, each time I try doing it, I try doing push-ups, maybe some flies, presses, what have you. It seems like I make the situation worse. So massages do help with it as well. So I know it's like I keep, I know it doesn't look right, but hey, I gotta calm it down somehow. I have tried using things like biofreeze, arnica. Arnica kind of helps. But that's the thing with them. Then we start with the aromas, and then of course that affects the allergies, and that winds up irritating in through here with the airway passages. And that's when I know the allergies are flaring up, is because I feel it right here in my throat and going down with the upper respiratory. But the pressure that I feel is lower, right base of the sternum. That's where I feel that. And then when the stabbing pains start, it's usually right in through here. It's like, that's the only way I could think to describe it. It's like, like I said, it's like I have a little gremlin or a little troll or something's in there with an ice pick, and he's just jabbing me from the side. That's all he's doing. Has to be a guy, can't be a girl. Yeah, I have to make a joke still. After all, we are talking chest pains, aren't we? I need to stop. All right. But yeah, I just wanted to get this out. Have this video ready. So in that way, maybe if I when I go to see the doctor again at the end of August, and if he just comes back, oh, it's just this or that, no, it'd be like, here, watch this video. Okay? So in that way you can see what I'm talking about, what parts I'm actually holding on my chest and stuff right here too. It's kind of migrating upward, which happens. And then of course affects my breathing. So anyway, all right. For those of you watching who are just curious or concerned, or maybe you're having the same issues or something, take it easy, all right? I love you all. Talk to you all soon, all right?